Hey everyone! Today we're going to start talking about the cardiovascular system and we're going to go into the physiological part of blood vessels. Oftentimes, when you go to the doctor's office, you're going to go and they're going to take your vital signs. That means they're going to check your body temperature, your respiratory rate, and the two others that are going to affect the body system we're learning about is going to be your arterial pulse, or otherwise known as your pulse, and your blood pressure. Now, your pulse is sometimes called a pressure wave because it's created by the alternate expansion and recoil of an artery with each beat. All that means is when our heart contracts and forces all of that blood out of our heart, the artery is going to expand or stretch. And then, as the blood finishes going through that artery, it's going to recoil or go back to its normal size. Now, our pulse, which are pressure surges per minute, are usually going to be about equal to our heart rate, and we learned that's on average about 75 beats per minute. So anything between 70 to 76 is going to be average for a healthy person. Now, remember, this can be influenced by a wide variety of things, such as activity, whether you're an athlete or you are going to be a sedentary lifestyle, postural changes, whether you're sitting up or laying down, and even our emotions. If you're somebody and you want to take your pulse, you can feel your pulse in any artery lying close to the body surface, and all you have to do is take your two fingers and press that artery against a firm tissue, and you'll be able to feel it kind of beat. These are also sometimes known as pressure points because this is where we can compress that artery to stop any blood loss during times of hemorrhaging. Now, one thing to do note is that oftentimes we take our pulse with our pointer finger and the one next to it, but you should not use your thumb because your thumb has its own pulse. Here's a picture that shows some common places where you can take your pulse. Oftentimes, most people take them in the common carotid artery in your neck. Doctors often take it in your radial artery, and then you can also measure pulse and even blood pressure from your brachial artery. And that leads us into blood pressure. Now, this section's a little long, so if you get confused, please make sure you rewatch any part of it. There are two ways we can describe blood pressure. First way, we can describe it as the pressure that blood exerts on the walls of the blood vessels. The other way we can describe it is the force that causes blood to be able to flow through the blood vessels and all the way back to our heart. Now, in terms of blood pressure, this always happens along a gradient. What that means is that when ventricles contract, blood is forced into these large, thick wall elastic arteries close to the heart. These arteries are going to expand because they're under very high pressure. However, as blood continues to flow through our blood vessels, it happens along a descending pressure gradient. Or, in other words, pressure is going to move from high to low. As pressure goes through these blood vessels and they get farther away, they cover more distance, the pressure is going to basically decrease. What that typically means is pressure is going to be high in the arteries, and in fact, it is going to be highest in the aorta. It's going to be a little bit lower in the capillaries, and then you're going to find pressure to be the lowest in the veins, which is often why veins have valves in them to help blood make its way back to the heart. The superior and inferior vena cava have the absolute lowest pressure of any of the blood vessels. And all of that can be illustrated here. Notice your aorta is going to have your highest blood pressure. Here we're going to call it the systolic pressure. And then as it goes through the arteries, arterioles, capillaries where gas exchange takes place, to your venules, veins, and eventually to your vena cava, you're going to see how there's a gradual decrease. Now, the continuous blood flow through all of these blood vessels is going to depend on how stretchy the larger arteries are and their ability to recoil. Now I'm going to underline ability to recoil because that's honestly the most important part. Oftentimes, people know that if they have balloons, they can blow air in them, and then if they let it go, the air comes out and the balloon shoots around the room. And the reason it does this is because it's able to recoil or go back to its normal shape. Now, oftentimes people realize that if you keep doing that, the balloon's going to stop going around the room as quickly because it gets too stretched out. Thankfully, our blood vessels do not get too stretched out, but that can happen. So the ability to recoil is important. It has to have enough force to push that blood through. Oftentimes, when you hear blood pressure, the disease arteriosclerosis happens to be mentioned. And all this is the loss of elasticity in our arteries, or it's called hardening of our arteries. And this can affect our blood pressure. When you go to the doctor's office, there are going to be two types of measurements they take when they look at your blood pressure. The first one is systolic, and the second is diastolic. Now, we've learned a version of these words when we talked about the heart. Remember, systole is contraction, and diastole is going to be relaxation. Here, we're going to specifically talk about the contraction and relaxation of our ventricles. Systolic is going to be the peak of ventricle contraction, where diastolic is when ventricles are relaxed. And we often are going to read these as your systolic pressure over your diastolic in the units millimeters per mercury. A typical human who is healthy has a range about 120 over 80. And oftentimes, if you go to the doctor's office, the auscultatory method is usually used to determine your blood pressure. Now, what is that method? Let's kind of go through. But before we go through, I do want to mention that oftentimes they do make this measurement at your brachial artery in your arm. So here's the normal average adult arm. We're going to assume his pressure is 120 over 70 because he's a young, healthy person. The doctor is going to put a cuff on him, and they're going to pump air into this cuff to increase the pressure. And eventually that pressure in the cuff is going to exceed our systolic pressure, and it's going to cut off blood flow into the lower part of that arm. So you'll see that there's no red down here, no blood flowing. Then what the doctor is going to do is with a stethoscope, they're going to put it here on the middle part of your elbow. They're going to start listening, and they're going to listen to where they first hear sounds of blood coming through that constricted artery into the lower arm. And they're going to record that number or that pressure as your systolic pressure. They're going to keep on listening, and then they're going to keep releasing pressure until that artery is no longer constricted, blood is flowing freely, and they're going to record that sound disappearing and blood flowing through there as your diastolic pressure. Now, our normal human range for systolic is about 110 to 140, and diastolic is 70 to 80. However, this is a range because blood pressure varies from one person to another and actually even varies within a person. Oftentimes, you will see blood pressure peak in the morning. What is normal for you might not be normal for another person. So I strongly always urge never compare yourself to somebody else. It can vary based on your age, weight, race, the mood that you're in. Are you physically active or you tend to lay around a lot? Even your posture. If you're ever worried about blood pressure, the number one thing I can do is stress. Go to your doctor, talk with them. They will know whether or not your blood pressure is in the normal range. And if it's not in the normal range, they can prescribe you any kind of medications that you might need. So what do I mean by it's not in the normal range? Well, there are two extremes. There's low versus high blood pressure. So what does it mean when I have low blood pressure? Oftentimes we call this hypotension. Hypo just means low. And we're talking about below 100 millimeters of mercury for my systolic pressure. Sometimes this can be just because of genetics or individual differences like your age, weight, and athletic concern. Most of the time, this is no cause for concern because it results from physically conditioning or running because you're an athlete. However, if you're not an athlete, your doctor might say that this is going to hint towards poor nutrition. You're not getting the foods that you need, or you don't have good enough levels of blood proteins, or your viscosity of your blood is too low. It means it's not thick enough. Oftentimes, acute hypotension is a warning sign for circulatory shock because you have lost too much blood or you might be hemorrhaging. On the opposite end of that spectrum, there can be elevations of blood pressure. Now, one thing to point out about elevated blood pressure is this is a normal response to fevers, physical exertion if you're running around exercising, or even if you're emotionally upset. So, if you're angry, or you're nervous, or you're shy, or you're afraid. This brief elevation of blood pressure is called hypertension. But if it's sustained for long periods of time, they also call it hypertension, high blood pressure. But this can be warning signs. So, hypertension is sustained elevated pressures of 140 over 90. This tells me that there's too much friction in the blood vessels, that my heart is working too hard, and this can actually eventually lead to a strain or damage on the heart and damage to your arteries. Now, with our blood pressure, we are going to end this out talking about different various factors that are going to affect it. So, without anything, we cannot go and not talk about our nervous system. Remember, our autonomic nervous system is what's going to play a role. Specifically, it's going to be our sympathetic. Remember, our parasympathetic has little to no effect. Our sympathetic has an effect because this is the one that's going to increase or decrease the diameter of my blood vessels. Oftentimes, it promotes vasoconstriction, so it narrows my blood vessels and causes my blood pressure to increase. Oftentimes, you're going to see vasoconstriction if you stand up suddenly, if you have hemorrhaging because it wants to make sure your blood pressure stays within a certain range, or if you're severely dehydrated. Vasoconstriction also happens whenever you're exercising or you're frightened in all parts of the body except your skeletal muscle. Now, the reason we're not going to vasoconstrict to our skeletal muscles is because we want blood to go there and deliver oxygen. So, wherever we have skeletal muscles, that's where we're going to see something called vasodilation. One thing to please note is we're never going to see vasoconstriction to specifically our heart or our brain because those are the two most important organs in our body in order to be able to live and sustain normal human functions. The other thing we're going to talk about is our renal factors or our kidneys. Remember we talked about renal veins or renal arteries? All that means is your kidneys. Kidneys regulate blood pressure by altering your blood volume, so how much blood you have. If your blood pressure is too high, we try to decrease the volume by getting rid of the water that you're going to see in your blood. So your kidneys, you're going to pee more often, release more water within your urine. But if your blood pressure is too low, we want to increase that blood volume. So we want to be able to keep more water in our body. In order to keep more water in our body, kidneys release something called renin, and that causes angiotensin II to form. This stimulates the release of aldosterone, which this is a hormone that enhances sodium or water reabsorption. So all that means is more sodium and more water stays in our body. The other one is going to be temperature. Now, oftentimes when you are hot, our blood vessels are going to vasodilate or they're going to get bigger. and this decreases our blood pressure because the diameter of our blood vessels are getting bigger. There's not as much force. However, whenever we are cold, our blood vessels are going to constrict or get smaller, and this is going to increase our blood pressure. It's going to circulate it around our body a little bit more. Chemicals can even affect blood pressure, so they can either increase or decrease it. Epinephrine, for example, increases heart rate and blood pressure. Nicotine actually causes blood pressure to increase by causing vasoconstriction, whereas alcohol and histamine causes vasodilation and decreases blood pressure. And then we're finally going to end it on diet. So most health professionals or dietitians say that what you eat is going to affect your body as well. It's commonly believed that a diet low in salt, saturated fats, and cholesterol prevents hypertension or high blood pressure. I'm going to go out on a limb and I'm going to say if you're worried about this, don't just go out and restrict these things in your diet. Please go to your doctor, get your doctor's recommendation. What should you do? Because even if you have high blood pressure, doesn't mean that you need to cut out all these things. Talk with a health person, talk to a nutritionist, and they will let you know. Okay. So here, this is the picture from your book that kind of shows what happens if you have a decrease in blood volume, exercise, if you change your posture, how different chemicals affect your blood pressure. So this is an awesome little chart that you guys can look at. It's located in your textbook. And that's the end of today's lesson. If you have any questions, please make sure that you reach out, and I hope you guys have a great day.